what mental health issues most impact the Sikh community? Again, what mental health issues most impact the Sikh community? I'd just like to get a kind of rough scope here. How many people here personally know someone from within the Sikh community that suffers with addiction? If you just look around, you'll see like the massive majority again. Now, I'm going to pass on that question to firstly Sandeep Kaur. So, in your experiences working within this, again, you know, addiction has been something that's been brought forward to us as an issue that needs discussion. But what mental health issues most impact the Sikh community from your perspective?
So I guess from my perspective, I guess depression is one of the common diagnosis, or people come with that. But like I was saying earlier, it's associated with domestic violence. So and that's quite interesting because in the social care context, the way sort of domestic violence might be seen in the Indian community is very different, actually, how Western community sees it and how the Indian community sees it. So I guess from an Indian perspective, it might be seen as being overly strict. I guess showing discipline, but actually that might mean something else in the Western sort of way of thinking. And I guess in terms of thinking about mental illness and domestic violence, it's hard for men where there might be domestic violence to open up about loss or feeling emotion. Men don't do emotions, so I guess that's quite stigmatizing in itself. So it's about how do we start having those conversations with men to be able to open up about what's been going on. I think another common thing that I often deal with is that a lot of parents, they come with children who might present with behavioural problems, and that actually might be more associated with mental health problems. But a lot of the families don't recognise that because, depression or anxiety isn't something that you think of. You think, oh, munda ladka hai, So it's about having, I guess, those conversations with parents and thinking about, what else could be going on. I'm just trying to think about other things that...
Well, we'll pass on to Ravjot Kaur. You work in West London as a psychiatrist. West London has a massive Sikh community. So in your experiences, what mental health issues most impact the Sikh community?
See, mental illness, it doesn't discriminate, but in the Sikh community, it can be kind of divided into age specific. So in our children, we have got the common things such as bullying, depression, anxiety issues, conduct disorder, which is kind of getting involved with the police and getting into trouble basically. We have emerging schizophrenia in children, that's coming about, eating disorders, feeling suicidal, self-harm, identity crisis.
So Benja, at this point, can I just ask you to maybe cover for the audience here as well that the different types, so like as in, I think that's very important for us to understand and to be educated on. So normally we'll just say depression, but obviously we know there's so many different types. So we've got OCD, we've got autism, and we've got health anxiety, we've got so many different variations of mental health.
Yeah.
And so for me, when I'm looking at this question, I'm thinking what mental health issues? So what would be maybe more predominant, and just to go through a little bit of the differences of intrusive thoughts, OCD, these disorders and what they are, just to give that education. This is going out live for people to understand the different types.
Yeah, I mean, there are so many, but if we keep it simple with depression, for example, like Baiju said earlier, you have got low mood. So low mood is a symptom of depression, but then you have got other associating symptoms as well, such as problem with your sleep. A child may be presenting as sleeping too much or sleeping too little. They may present with poor concentration at school. weight gain, weight loss, starting to become isolated. So there are different symptoms that we look at and then kind of call it depression. Same with the other disorders that we classify for our benefit, really, to see where that person is. So that's kind of a session for another day, I think. That's in children. In adults, again, you've got the same sort of things. Again, you've got depression, identity crisis, especially, people coming from abroad. We all are at some point, aren't we? So we have kind of cultural issues, integrating. We have, this is a new, well, not new one, but one that we're starting to talk about, which our aunties and uncles are talking about, which is, sade bacche vyah nahi karde pe. That's causing a massive amount of anxiety. It's actually causing into anxiety and depression. So those kind of ones are coming through. Another one that I would like to just touch on is cancer. So health-related mental health diseases is a big one. We're not used to it. We're not familiar with it. So it's causing a lot of depression. Financial problems, addictions again, and in the elderly, things such as dementia, that's a big one. And again, depression coming in, perinatal problems with mothers who are having children, just about to have children. That's a big problem.
Just passing on to Herbal, you mentioned earlier that sometimes you're described as the Bagaldar doctor. When people are saying this, what do they expect you to be dealing with specifically?
Well, mostly it's family and friends and people in the community, and especially when I go to the Gurdwara, it's like Bagaldar doctor kind of thing, and it's a joke.
Yeah.
It's taken as a big joke. It's taken, for some people, it's being as a less of occupation or less demeaning. So not only are they demeaning mental health, they mean demeaning mental health professionals. So it's like ha 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 tu pagal laga, etc, etc, etc. So that stigma comes onto it.
Do you think that actually stops people recognizing genuine issues of mental health within the Sikh community?
In terms of recognizing, if I was an accountant, a lawyer, or a businessman, my order would be slightly higher than it is at this present moment. Not to say that mental health professionals are not respected, but in terms of the hierarchy of things, my son is a doctor, my son is an accountant, my son is a lawyer, is a more of a bigger factor nowadays than my son helps other people through their issues that they have. And coming from my own personal perspective, I don't see many Sikh people in my region. It may be due to demographics, maybe due to location, but as a professional, very, very rarely do I see Sikh men. Might see a Sikh woman once in a while, but off the records, I get phone calls coming from a number of locations. It goes, Herbal, I need to talk to you about this. Herbal, I've got this problem. Herbal, my family member's got it. Or classic, my friend has got this. What can I do? And and it starts off with my friend is this, but as soon as you work through those barriers of actually what's going on, you realise it's not the friend, it's the person you're talking to. But even when that taboo comes to it, I'm going to briefly touch on to something that's I'm doing quite a lot with, is working with men, especially those who go through the use addiction. Addiction for me is a big problem in our community. Alcohol. I talk to my male counterparts and they go to me, Herbal, you don't drink alcohol? I go, no. She goes, I went to a Sikh Punjabi wedding and there's more alcohol on the table than there's Coke. And I'm like, well...
How many people have heard that then, that general assumption?
And nothing, it's one of the things, we trying to fit into the Western world, and the image that we created of the Western world is basically we just like having a jolly. Before this used to be the Irish. It's like Irish people are this. Now the Asian community is coming into it. Addiction is a big thing because sometimes addiction is the last resort for some people, especially for men. Men tend not to get treated, they tend to get punished. In our community, going forward, not a lot of men talk. They're meant to be the head of the family, they're meant to be the kartar darta of the family, and even when things like bereavement, if you see a man cry in a gurdwara, that's it. There's something wrong with him. So in our community, actually being a male, talking about your emotions is quite difficult. So people will turn to alternative things, alcohol being one of them. Alcohol allows them to actually escape from it, drugs being another one. Allows them to escape from actually the reality of what's going on for that moment in time, for them to actually go from there. And people tend to forget to escape, and that's what nowadays mental health is becoming. It's becoming an escape from reality.
Yeah, just before we pass on to the audience, if we hear from groups that, individuals that do serve in the area of mental health, what is kind of commonly brought to you guys, firstly Gajan Singh with the Sikh helpline, in terms of Sikhs talking about mental health issues that they're suffering with?
Loneliness and isolation is a big thing.
Wow.
So the common thing of, my husband's passed away or my wife's passed away, the kids have gone off to uni, and I don't know what to do with myself. You could argue that's not a Sikh specific problem, but we're so engrossed in not talking about our problems, the things that our common neighbours in our community may feel quite comfortable talking to someone about, we keep it within ourselves. Other problems that we don't, because as an Indian community, we're scared of death. The word death, you don't talk about it, and children shouldn't go to funerals, and when you go to a dead person's house, you have to do XYZ rituals, allegedly, and we're scared of death, and we have the fear of death put into us. And then when there's a bereavement, when someone close to us has died, we don't know how to deal with it. Yet, from a Sikh perspective, we embrace death, because death is just another part of life. And it's understanding that what the Sikh teaches, we become so disconnected to what our Sikh teachings are, that is not always, but often part of the problem of part of the problems that we have. It's a disconnection. So I go to the Gurudwara all the time. I was like, yeah, but what have you learned? I don't know, I just go because I was told to go. So ritualism is a big problem. Another thing one of the audience members touched on was the issues we have with society. It's we go to places to hear things, we don't go to listen.
Good point.
And that makes us a bit weaker. And another a big issue that comes up is, I don't think it's not so much here, but we talk about like male mental health issues. Suicide. Yeah, I mean the ratio for male suicide compared to female suicide, I don't know the statistics, I'm sure.
Which is the age of 25 and 40 is highest suicide. It's highest form of
In
death.
men.
Yeah.
So just to clarify what Viji said, there's the highest form of death in male from the ages of
25 to 40.
From 25 to 40. But what I want to add to that is one thing that it's overlooked a lot is, because the question here again I'm clarifying is that what mental health issues most impact the Sikh community. So that is also talking about where some of these are coming from. And what we want to do here is today we don't want this to just be another event. So and then start looking forward to what's the next event now. And so what we want to do is empower each other and the Sikh community out there. So one thing where things like mental health is occurring from. So even within Sikhs, as young children growing up, there's been a lot of sexual abuse that's taken place as well by close cousins or relatives. And often that isn't actually expressed and shared until a lot later in life. And when they actually understand what happened to them by a close relative or a cousin that they're still associating with and their family's still associating with, and maybe 10 years down the line, 15 years down the line, when they kind of realize, oh, you know what, I think this is what happened to me, and they sometimes they'll express that to their families and parents, and their parents are like, well, we can't do anything, that was your taida munda, and we actually can't say anything to them, I can't upset your taya. And then that child is living with that, knowing that their parents aren't going to take a step. They feel too guilty and ashamed to bring it out. They don't know how to approach that person. Do they want to go down the line and the route of getting the police involved? So there's a lot of these cases, more than we realize. And the more we start digging into people, the more this will actually come out. And this is another big reason for why mental health is occurring. That's just one of many things that are happening. So what we need to do is now, looking forward from this, is creating a platform and empowering people to say how we can deal with these type of cases too, and what help are we going to provide, because as a Panth, we are very powerful, and I really feel that, you know, even if there's a little bit less money spent on marble for Gurdwara, and I don't think we need £1 million or £17 million spent on Gurdwara. What we need is more structures and charities set up that have got enough professionals employed to be able to specifically deal with these cases, but based off Gurbani. So what we don't want to do is sidestep from Gurbani and what Gurbani is saying. So we don't want it to be that somebody called Sikh Helpline, and the only option they've got is to go to a professional that works for NHS. I'm not talking down at them, but I'm saying they've got plenty of clients that are going to come to them from the widest community. But as a Panth, if we've apparently so got the biggest jewel is Gurbani, if we can't tap into that and find the actual the way mental health works from Gurbani, we can't keep just like a parrot style keep chanting the words, our Bani's got everything, our Bani's got everything, but we've got nothing in place. We've got no structure in place if you're having a breakdown, but even though most of Gurbani is talking about your mind. So we've got to now think of what we're going to build for this, and how we're going to actually help our community be empowered to speak about it. They're only going to speak about it if they know we've got a solution for them. But if we're just going to pass them pillar to post, actually try that organisation, actually try that one, or just go back to your doctor. So we've actually failed them then.
So a running theme here seems to be that whilst we can kind of guess really what mental health issues most impact the Sikh community, we'll never really know until we create means for real dialogue in this issue. If anyone else from the audience would like to make a contribution.
I'm a psychologist by trade, and often I get the same story, which is, can you just do some psychology with them? And I think other people might have heard this too. Can you just sort it out for us? So when I bounce it back, that actually, and what we've talked about today is actually a wider thing. The community, the kind of Western systems, the pathologizing language. I think people don't like being held accountable to that.
When you say people, are we talking all of us? Within the Sikh community, or also within the mental health industry?
Yeah, all of us.
Okay.
Because some people do like the power of being an expert, and I could be like, yeah, I can sort it out, I've got magic powers, but I haven't, and that's the main thing. So my question is, we could think of one point to take away today, and I know I have one, but I was just wondering what the panel thought, if you wanted to the audience to take away one point. What
I think that would be a great thing to do at the end of the event. So if you can remember to ensure that we do address that at the end of the event with the last question, that would be great. So not to kind of discuss that, but we'll definitely get to that at the end, so everyone can kind of bear in mind one thing to take away from this.